to go around in a healthcare system still straining from the pandemic. News Edge reporter Christopher King talks with a doctor tonight who's thinking about leaving the field because she says she has had enough.
You've heard of the Great Resignation. More and more doctors are joining those ranks. The pandemic is taking its toll, and doctors are getting burned out.
It's been emotionally and physically draining.
The past 2 years have been tough on Dr. Eva Ballou.
It's been beyond anything that all of us expected that it would be.
Dr. Ballou works in a Metro Atlanta hospital. She's been on the front lines of the war against COVID-19.
Not having anything to cure COVID has been really stressful.
It's easy to burn out.
I think the pandemic really exacerbated and fast-forwarded the burnout process. 1
in 5 doctors could leave the field in the next 2 years, according to a study by the Mayo Clinic. Are you thinking about leaving the profession?
Yeah, I actually have thought about it multiple times.
Dr. Ballou cites high workloads, understaffing, and the sheer crush of COVID patients in the early days of the pandemic.
Doctors getting sick, nurses getting sick.
Doctors have to fight politicization of a deadly global health crisis and the constant flow of misinformation.
So losing any physicians at all in mass would be a tragedy for this country.
Dr. Cecil Bennett is the medical director for Noonan Family Medicine. He says losing 20% of doctors would create a health crisis.
We're well short, probably anywhere from 30 to 40,000 doctors or primary care physicians.
Dr. Ballou became a physician to help patients.
I do love medicine. Medicine is my passion.
She would hate to leave the profession she loves. The Mayo Clinic study also recommends providing medical staff with more protective health gear, reducing the workload, and providing more access to mental health care. Christopher King, Fox 5 News.
All right, let's talk a little weather now. It was certainly nice to get a little extra vitamin D this evening.